So you're sitting across from your doctor and discussing the treatments you've tried for your autoimmune condition that maybe haven't quite hit the mark. And they look at you and say,
At this point, you're a candidate to try IVIG.
and you're thinking, great, I'm willing to try anything to feel normal again. I only have 2 questions. What is that? And how much is it going to cost me? I'm back with completely updated information on intravenous immunoglobulin therapy for 2025, including the latest protocols, cost considerations, and what's changed since my original video I did in July of 2022. Whether you're just IVIG curious or your doctor just prescribed it, this guide will walk you through everything you need to know now in 2025. So what exactly is IVIG and how does it work? Intravenous immunoglobulin is essentially a product made from the antibodies of thousands of plasma donors that help fight infection and regulate your immune system. And that is a very simplified breakdown. And the term immunoglobulins is just another way of saying antibodies. And if you haven't watched my Immune System 101 video, check that out first. It's only 5 minutes long, and I'll put the link in the description because what we're covering here in this video will make a lot more sense with that foundation first. It was also only the second video I ever recorded for Lucid Med, and it kind of shows. So there are 2 major uses for IVIG in general. The first is the autoimmune category, which is where your body is making dysfunctional antibodies. And this can be triggered by any number of things: genetics, toxins, viruses, vaccines, bacterial infections, diet, medications, other health conditions. But regardless of what the initial catalyst was, the result is the same. A series of complex immune responses has now been activated, and the resulting antibodies, now called autoantibodies, have marked healthy tissue for destruction. And it needs to be regulated. The interesting thing here, though, is your body doesn't realize its immune system has gone rogue. People approved to donate plasma for IVIG have been thoroughly tested. I mean thoroughly. And their antibodies deemed to be normal and healthy. So when we infuse them into someone with autoimmune disease, the body naturally registers that there's now a surplus and suppresses its own production of the dysfunctional ones because it doesn't like to double up on work.
Also unnecessary.
The result? Tremendously reduced inflammation and an interruption in the ongoing assault on your tissues. This gives the body a break, allowing it to repair and heal. And the second major category is immunodeficiency. And there are several subcategories under this heading, but to simplify, this is a 2-horse race, basically. There's either a genetic issue present from birth, rendering the body incapable of producing sufficient quantities of healthy antibodies, or it's been impacted by a disease process or some external factor that's now making the immune system ineffective at fighting infection. In this case, IVIG serves as passive immunity, filling in the gaps where the immune system is deficient, whereas in autoimmune conditions, it acts more like an immune system modulator rather than a direct antibody replacement. We now have some expanded indications for IVIG therapy as of 2025. It continues to be a powerhouse treatment for fighting inflammatory autoimmune conditions like CIDP and boosting immunoglobulin levels in conditions like primary immune deficiency. But we've also seen newer FDA approvals for specific formulations in conditions like multifocal motor neuropathy, which is a rare chronic neuro disorder that affects the motor nerves, causing progressive muscle weakness and loss of function. In certain dermatological conditions like pemphigus, which is a rare disorder that causes painful blisters and sores in the mouth, throat, and even possibly the genital area. And also select cases of autoimmune encephalitis, where the immune system attacks the brain, causing inflammation leading to memory loss, confusion, seizures, personality changes, and movement disorders. But I also want to mention small fiber neuropathy here because While it's not an FDA-approved indication, it doesn't necessarily mean it's a full stop either. However, this is also one of those conditions that has components that closely related to something that is approved, like CIDP. So when we do go to bat with insurance companies to get somebody on this that has small fiber, it's considered an off-label use. And again, it's typically a battle to get it approved. However, it's not impossible. It's not a walk in the park, but it's not impossible either. Now, these aren't disease-specific preparations of IVIG, but rather expanded regulatory approvals allowing patients with these conditions to access this treatment and get it covered by insurance. Administration methods in 2025. Okay, so IVIG administration hasn't changed dramatically, but there have been some refinements. Traditional IV infusion is still the most common method. A nurse will start an IV catheter and the medication gets delivered through your vein. In contrast, the subcutaneous route, or SCIG, is given through the layer of fat underneath your skin, and this is usually in the abdomen, upper arms, thighs, or hips. Since 2022, the technology has improved in terms of better needle sets that cause less tissue trauma, pump systems that have more precise flow control, and concentrated formulations that require fewer infusion sites. The company that I work for specializes in home infusion of IVIG, and I do have a separate video specifically on this type of administration in case any of you are completely confused about what I'm talking about here. So just know that SCIG is a self-administered therapy. Don't panic. A nurse will come to your home and teach you everything you need to know. But to give you an idea, you're taught how to insert a very small needle, or sometimes several small needles, into the appropriate areas, and the fluid will sit there for about 24 to 48 hours until fully absorbed. Most patients find this more convenient than arranging to go to a hospital or an infusion center, and home infusion is the easiest and most preferred option on average because IVIG infusions take time, usually anywhere between 3 to 7 hours a day, and it's over 3 to 5 consecutive days for each treatment cycle, and that is a significant time commitment each month. Most would rather have this while sitting in their favorite chair and binge watching Netflix. All right, side effects: the good, the bad, and the headachy. Common side effects haven't changed really either. They can include chills, fever, stomach upset and nausea, joint pain, lower back pain, and headaches, which are often the most common complaint.
Awesome.
Now, I've always been straightforward with patients. The headaches can be intense. They're typically described as severe pressure that can be quite debilitating. On average, they start within a few hours to a day of the infusion, and they can last anywhere from a few hours to about 72 hours. Though in some cases, like a septic meningitis, which is a pretty serious complication of IVIG, the pain levels can range anywhere from 2 to 10, and it can be a severe headache, and also include nausea, light sensitivity, kind of like a really, really bad migraine. And this is why your doctor will typically prescribe pre-medications, including Tylenol, Benadryl, and sometimes IV fluids like normal saline before and after your cycle. Occasionally, we'll take a more customized approach to keeping you as comfortable as possible. Often patients will know their body well and will proactively work with their doctor to tailor their support medication protocol. If you're unsure, ask your pharmacist or nurse prior to your first visit. And if you come to me as a therapy-naive patient, then I'm going to spend a considerable amount of time answering your questions and reviewing your health history so I can anticipate what may make you more comfortable during treatment initiation, and then I will consult with our pharmacists and reach out to your doctor to suggest all of them. Hydration is your new best friend. Hydration is key. I cannot stress this enough. The better hydrated you are, the fewer side effects you'll likely experience. And my recommendations for 2025 also have not changed here. Start hydrating about 24 to 48 hours before your infusion for best results, and drink as much water as you're comfortable with before and during treatment. If I'm infusing you, then I'm bringing you glasses of water constantly to sip on while it's going on. Consider low sugar drinks, even Gatorade. Gatorade has sugar. So try and keep it to water, teas, things like that, because artificial sweeteners can sometimes trigger headaches on their own. Now, what if the side effects hit during treatment? If you start experiencing headache, nausea, or other symptoms during the infusion, then tell your nurse immediately, because we'll reduce your infusion rate and can administer additional medications depending on the issue, though certain sensations are completely normal during an IVIG infusion and typically also temporary. And these might include BP elevation or a drop, itchy skin, which is why we give you the Benadryl, fatigue, especially after the infusion is over. You kind of just want to sleep. You can have chills or even a low-grade fever, mild muscle aches and joint discomfort. You can have some flushing and some dizziness. Now, you're probably saying,
this is not something that I want to voluntarily sign up for.
But we expect all of them. And if you do experience them, they'll typically only last for maybe around 24 to 48 hours. And we will use everything available to us to make you super comfy. Rash reactions. All right, there's one side effect that tends to launch a sneak attack that's worth mentioning. And that's the rash that we'll occasionally see with IVIG. And it deserves special attention. So unlike many side effects that occur during infusion, this rash often appears anywhere from usually around 8 to 10 days after your last infusion day, though it can sometimes also emerge up to 14 days later. These rashes often present as red, raised bumps that are intensely itchy and commonly affect the palms, trunk, back, or extremities. And at first, this is sometimes mistaken for an allergic reaction, but the appearance of a rash does not necessarily indicate this. In many cases, it represents a normal immune response to the foreign proteins that are now working to repair your body. However, it should always be reported to your health provider, as they may want to adjust your pre-medications and consider a different IVIG brand for you, and also rule out a true allergic reaction. So if this rash crashes the party, then taking photographs to show your health provider can be extremely helpful, especially if the rash resolves before your next appointment. And treatment for this consists of antihistamines and topical cortisone. Every now and then, it will continue to the point where we need to look at possibly putting you on another brand of IG. Some people just have a sensitivity to certain components in a particular brand, and normally this isn't cause for concern. You might have a little bit of a delay between treatments if we do have to request a new authorization. The anaphylaxis talk, it's less common than you think. IVIG gets a bad reputation for allergic reactions, but the incidence of true anaphylaxis is actually quite low. It's under 1%. A true allergic reaction, the kind that makes us infusion nurses sweat a little bit, includes chest tightening, difficulty breathing, a feeling of choking or like your throat is closing, facial swelling, and hives.
It's not that serious.
Benadryl. A lot of Benadryl. A lot of Benadryl.
What? Oh!
For this situation, your nurse will have an anaphylaxis kit containing steroids, additional Benadryl, and epinephrine if deemed necessary. So we're trained to handle these situations, and we'll always check to make sure that that anaphylaxis kit is present in your home before we even start your IV. Like, that is actually the first thing that I check when I am going to a new patient's home to infuse IVIG. I will make sure that I have that anaphylaxis kit there before I do anything else, because if I don't, then that is a hard stop for the rest of the visit. So there's no point to it. Unless it's there, we cannot do anything. And in general, if you do get any of the side effects that we just talked about, the nausea, headache, whatever, they're normally short-lasting and will improve with each cycle you get. So many times, usually within the first few cycles, I am not in a hurry to switch them off of that brand. And the reason is as I said, these tend to improve with subsequent cycles. And if we switch you that quickly, when you've only infused once or even just for a few days, if we switch you prematurely to a different brand, you're constantly in that new initiation period, that new induction period. So you're going to have a headache and all of those side effects, likely with the new brand as well. So that's just something that you want to be mindful of. All right, when should IVIG start working? So this is probably the fourth most common question that I get after what is it, what are the side effects, and how much does it cost, which we'll be getting to shortly. Most patients notice improvement within a few weeks of starting treatment, but I always say 9 out of 10 times. But the response time varies considerably depending on the specific condition, how long you've had it, and the individual way that your body processes the treatment. I've seen patients respond differently across the spectrum. Some feel changes after the first complete treatment cycle, while others may need monthly rounds for 6 months to a year before noticing significant improvement. There's a certain unpredictability to how each person's immune system will respond and at what pace. How long can I expect these IVIG benefits to last? So the effects of IVIG typically last for 3 to 4 weeks, and this is because your body makes new antibodies roughly every 21 days, as I mentioned earlier. This timeline remains consistent with what we've known since we discovered IVIG in the early 50s. And this is crucial to understand because if you stop taking it, the benefits generally fade as your body metabolizes the administered antibodies. This is why monthly administration remains the standard for most conditions, regardless of the specific product used. Dosing in 2025, the magic behind the math. IVIG is still weight-based, so having a current and accurate weight is imperative. This will then be converted to kilograms by dividing your weight by 2.2 and then calculated according to whether you have a neurological condition in which the doses are typically a bit higher or an immune deficiency, which equates to a lower dose. For example, George here has CIDP and weighs 180 pounds, which works out to be about 82 kilograms. Neuro-based dosing is typically 2 grams per kilogram of body weight, giving us a total dose of 165 grams. And this next part is important because if George was to get all 165 grams in one infusion, he would be rather ill. He would be sick. It would overwhelm his system, which is why we divide your total dose over 5 days initially. 165 grams divided by 5 equals 33 grams a day. Much easier to take, easier side effect management, and smaller chunks of your time that the nurse is occupying your dog's favorite chair while she's there. Since 2022, some neurologists have begun to explore more personalized dosing strategies based on clinical response rather than strictly adhering to the 2 grams per kilogram guideline. And some patients now receive slightly lower or higher doses depending on their specific condition and response patterns as well. Vaccines and IVIG, it's a matter of time. So since IVIG affects immune function, timing your vaccines matters. For general vaccines like the flu or COVID, pneumococcal vaccines, etc., you can get them really at any point. But response is typically improved if you space them out about 2 weeks from your IVIG cycle. And yes, you should get them while you're on IVIG. For live vaccines, however, like measles, mumps, rubella, varicella, you should delay them for approximately 6 to 8 months from your IVIG infusions, according to the CDC. Now, this isn't an exhaustive list, and with every situation, there may be other considerations by your doctor, so follow their direct advice. Most of these vaccines are given during childhood, and if your titers are within normal range, then this is a moot point anyway. So what can you do to prepare for your IVIG infusion? Well, there are no dietary restrictions, but since IVIG can cause stomach discomfort, consider avoiding spicy foods, skip heavy or rich meals, and maybe hold off on the alcohol. Remember, hydration is very important, and alcoholic drinks can dehydrate you. So, just, the big question, cost in 2025. The cost question is still complicated, and it depends on just so many things. Your insurance policy, where you are in your deductible cycle, whether your diagnosis is covered, the specific IVIG product prescribed. While some patients have zero copays, others might face significant costs. I've seen out-of-pocket expenses range from nothing to several $1,000s, but since 2022, several positive developments have occurred in the financial landscape. More manufacturers offer copay assistance, and most specialty pharmacies have established financial hardship programs that, if you're approved for, will cover the cost of the therapy. There are also foundations such as PAN and NORD that have grants available for those with specific diagnoses, and these can significantly offset costs. Several states have also passed legislation improving IG coverage for immune disorders, and more diagnoses in general have gained coverage status. Nevertheless, cost remains a significant concern for many patients, and I get it. Always speak with your insurance provider and explore all assistance options available through your healthcare provider and infusion pharmacy. Usually, if we have a new patient, or any patient, but a new patient, we'll do their insurance, we'll run their benefits, and if we see that they're going to have a high out-of-pocket or a high copay, we have already done all of that work on the back end. We will look into copay assistance proactively before we even get you approved most of the time. Sometimes we need to wait until we've actually submitted the auth and it comes back, whether it's approved or not, but we'll get deeply into the weeds here if I start explaining all of that. So if you have any questions, speak with your referral specialist at your specialty pharmacy. They are usually the best resource for this information. You can call your insurance company as well, but they might not be as helpful. Just saying.
That's not our problem.
So if you're on this therapy, or you've been told that you should be, there's a lot more that you need to know. How many donors does it take to make your batch of life-saving medication? And what's the screening that they go through like? How is it made after the plasma is collected? And I talk a little bit more about that allergic reaction potential. So watch this next. And in the meantime, stay healthy and lucid.